Question 1. A central service (CS) technician is wrapping a lightweight instrument set using a flat wrapping technique. To secure the package and provide visual evidence of processing, which of the following items should the technician apply to the exterior? A. Masking tape. B. Indicator tape. C. Metal safety pins. D. Sterile rubber bands. Correct answer B. Knowledge point explanation. Core rationale. Indicator tape is a dual-purpose closure method. It securely seals wrapped packages while acting as a Type 1 external chemical indicator, changing color to visually confirm that the package has been exposed to the sterilization process. Trap analysis. Option A is incorrect because general masking tape lacks the necessary adhesive properties for high sterilization temperatures and does not provide chemical indication. Options C and D are fatal errors. Safety pins puncture the sterile barrier, and rubber bands do not create a validated seal. Concept extension. Remember that external indicators only prove exposure to a sterilization cycle, not that the contents inside are sterile. Always verify that the tape is fully adhered with no loose edges to maintain the package's integrity. Question 2. During the assembly of an orthopedic tray, a sterile processing department (SPD) technician prepares to wrap the final set. According to industry standards, which of the following must be placed in the center of the tray before the packaging is sealed? A. A biological indicator, BI. B. A Type 1 external indicator. C. An internal chemical indicator, CI. D. A patient tracking label. Correct answer C. Knowledge point explanation. Core rationale. An internal chemical indicator, CI, is mandatory inside every single sterilized package. It must be positioned in the area considered most challenging for the sterilant to reach, ensuring that the sterilizing agent successfully penetrated the packaging and contacted the instruments. Trap analysis. Option A is incorrect. BIs are highly reliable but are typically run daily or with implant loads, not inside every routine tray. Option B is placed on the outside of the package. Option D is for record keeping on the exterior, not an internal verification tool. Concept extension. If the internal CI does not show a passing color change upon opening in the operating room, the entire tray must be immediately rejected as unsterile, regardless of the external tape's appearance. Question 3. Which of the following flat wrapping techniques utilizes two separate layers of packaging material, applied one after the other, to create a protective package within a package that allows for a secondary aseptic presentation in the operating room? A. Envelope fold. B. Simultaneous wrapping. C. Square fold. D. Sequential wrapping. Correct answer D. Knowledge point explanation. Core rationale. Sequential wrapping dictates that two individual sheets of wrap are applied in sequence. This method provides an exceptional dual barrier system. When the circulating nurse opens the outer layer, the scrub technician still has an intact inner layer to open, granting a second chance at maintaining the sterile field. Trap analysis. Option B is incorrect because simultaneous wrapping applies two bonded sheets at the exact same time as a single unit. Options A and C describe the geometric folding styles, how the corners are folded, not the layering application method. Concept extension. Although sequential wrapping is more time-consuming for the technician, it is historically favored for its robust physical protection against dust and handling damage during extended storage. Question 4. All sterilization packaging materials, including rigid containers and woven wrappers, are heavily regulated to ensure they provide an effective microbial barrier. Which government agency classifies these packaging systems as Class II medical devices? A. U.S. Environmental Protection Agency, EPA. B. Centers for Disease Control and Prevention, CDC. C. Occupational Safety and Health Administration, OSHA. D. U.S. Food and Drug Administration, FDA. Correct answer D. Knowledge point explanation. Core rationale. The U.S. Food and Drug Administration, FDA, has strict oversight over all medical devices. Because a failure in sterilization packaging directly compromises patient safety, the FDA classifies wrappers, pouches, and rigid containers as Class II medical devices requiring a 510(k) pre-market clearance. Trap analysis. Option A is a common distractor. The EPA regulates environmental disinfectants and sterilant emissions, not packaging. Option B issues infection control guidelines but has no regulatory enforcement power over products. Option C strictly governs employee workplace safety. Concept extension. A Class II designation means the manufacturer must submit scientific data proving the packaging material allows sterilant penetration, facilitates drying, and maintains a sterile barrier post-processing before it can be sold. Question 5. An SPD technician is preparing single-use scopes for a hydrogen peroxide gas plasma sterilization cycle. Because the sterilant cannot penetrate cellulose, which type of pouch material must the technician select for packaging these delicate items? A. Woven muslin fabric. B. Paper and plastic combinations. C. Spunbond polyolefin and plastic combinations. D. Canvas wrap materials. Correct answer C. Knowledge point explanation. Core rationale. Low-temperature methods like hydrogen peroxide gas plasma require non-cellulosic materials. Spunbond polyolefin, such as Tyvek, paired with a plastic film is exclusively designed for these cycles because it does not absorb the active sterilant, ensuring the gas reaches the instruments. Trap analysis. Option B is the primary trap. Standard paper plastic pouches contain cellulose paper, which absorbs hydrogen peroxide, causing the machine cycle to abort. Options A and D are traditional woven cotton/linen materials heavily laden with cellulose and completely incompatible with low-temperature gas plasma. Concept extension. Conversely, spunbond polyolefin pouches must never be processed in a standard 270 degrees Fahrenheit steam sterilizer, as the extreme heat will instantly melt the synthetic fibers onto the instruments. Question 6. A technician is preparing various individual instruments for sterilization. When utilizing standard paper and plastic combination pouches, which two sterilization modalities are the only acceptable methods for this specific packaging material? A. Steam and ethylene oxide, EO. B. Steam and hydrogen peroxide gas plasma. C. Ethylene oxide, EO, and dry heat. D. Hydrogen peroxide gas plasma and ozone. Correct answer A. Knowledge point explanation. Core rationale. Standard paper and plastic pouches utilize medical-grade cellulose paper. This material is fully compatible with the penetration properties of both steam and ethylene oxide, EO, sterilization cycles, allowing effective microbial lethality and subsequent aeration or drying. Trap analysis. Options B and D are incorrect because hydrogen peroxide and ozone are low-temperature methods that are absorbed by the cellulose paper, which causes the cycle to abort or fail. Option C is incorrect because standard paper and plastic pouches will melt or degrade under the high temperatures of a dry heat sterilizer. Concept extension. Remember that if a low-temperature cycle like hydrogen peroxide is required, the technician must switch to a synthetic spunbond polyolefin pouch, like Tyvek, instead of a standard paper pouch. Question 7. A newly hired sterile processing department, SPD, technician is labeling a paper and plastic combination pouch containing a surgical clamp. To prevent compromising the microbial barrier, where must the technician apply the felt tip marker to document the lot control information? A. Directly on the medical-grade paper side. B. Across the heat-sealed chevron border. C. Only on the transparent plastic film side. D. Over the external chemical indicator tape. Correct answer C. Knowledge point explanation. Core rationale. Industry standards dictate that all labeling on peel pouches must be written exclusively on the clear plastic film side. This practice ensures visibility while protecting the porous structure of the packaging from chemical damage. Trap analysis. Option A is a critical error. writing on the paper side can cause the ink to wick through the cellulose fibers, potentially contaminating the instrument or creating microscopic holes that destroy the sterile barrier. Options B and D are improper locations that could interfere with the package's seal integrity or the chemical indicator's readability. Concept extension: always use a validated, non-toxic, permanent felt tip marker designed for sterilization. Never use ballpoint pens, as their sharp tips can easily puncture the packaging materials. Question 8. Maintaining the integrity of a sterile barrier is a fundamental requirement in preparation and packaging. Which of the following items is strictly prohibited from being utilized as a package closure method because it destroys the sterility of the package? A. Indicator tape. B. Heat-sealed patches. C. Paper clips. D. Tamper-evident seals. Correct answer C. Knowledge point explanation. Core rationale: any closure method that creates holes, punctures the wrapping material, or fails to provide a continuous, validated seal is completely unacceptable. Paper clips, safety pins, and staples physically compromise the barrier, allowing airborne microorganisms to enter the package. Trap analysis: option A is the standard, validated method for securing flat-wrapped items. Option B is the approved method for repairing minor holes in reusable woven textiles. Option D is required for securing the latches on rigid sterilization containers. Concept extension: rubber bands are also strictly prohibited for closing packages because they do not form an airtight seal and their tension can cause the wrapping material to bunch up or tear during the sterilization process. Question 9. A technician is tasked with wrapping a small, lightweight basin set and several individual surgical retractors. To facilitate an aseptic presentation for the scrub nurse in the operating room, which specific flat wrapping technique is most commonly recommended for these smaller items? A. Square fold. B. Envelope fold. C. Simultaneous wrapping. D. Cylinder fold. Correct answer B. Knowledge point explanation. Core rationale: the envelope fold is the standard and most efficient flat wrapping technique utilized for small packs and the vast majority of instrument trays. It creates a compact package with a final tab that allows operating room staff to open the item without reaching over the sterile field. Trap analysis: option A is primarily used for large, bulky items like heavy linen packs or surgical gowns, not small trays. Option C refers to the layering application method, using two bonded sheets at once, not the geometric folding pattern itself. Option D is a fabricated distractor that does not exist in sterile processing standards. Concept extension: regardless of whether the envelope or square fold is used, the technician must always ensure the wrapping material is snug but not overly tight, preventing tears while eliminating loose pockets where air could become trapped. Question 10. Traditional woven cotton textiles, such as 140 thread count muslin, represent a specific category of sterilization packaging. Because these materials must be laundered and meticulously inspected on a lighted table between every use, they are classified as A. Disposable packaging. B. Synthetic non-woven barriers. C. Reusable packaging. D. Rigid containment devices. Correct answer C. Knowledge point explanation. Core rationale: muslin and similar woven barrier fabrics are classified as reusable packaging materials. Unlike single-use items, they are designed to withstand multiple cycles of use, provided they are properly rehydrated through laundering and pass strict visual inspections for physical degradation. Trap analysis: options A and B describe modern materials like spunbond, meltblown spunbond, SMS, wraps, which are single-use, non-woven synthetics that are discarded after one procedure. Option D refers to metal or high-temperature plastic container systems, which are also reusable but are not woven textiles. Concept extension: if reusable woven textiles are not laundered between uses, the cotton fibers will become severely desiccated, dehydrated. This lack of moisture can lead to superheating during a steam sterilization cycle, ultimately causing sterilization failure.